I am Dr. Suleman Dosani, consultant critical care, Prathima Hospitals Kukatpally, Hyderabad. I would like to tell you about our hospital. We have a dedicated critical care services round the clock 24/7. We are well equipped with logistics here. We have 2 ICUs. Each ICU is of 10 bedded. We have invasive ventilators. We have dialysis units. We have endoscopies where we do for emergency procedures like GI bleeds and elective. We have other services here. I would like to tell you about what all cases we regularly see here. We see cases of drug overdoses, poisonings, polytrauma, acute myocardial infarctions for which we have a dedicated cath lab. We see patients coming in fluid overload in background of CKDs or having severe sepsis with acute kidney injury, where we have a dedicated nephrology, where if they require, they undergo dialysis and then supportive care. We have neurological services here, where patients having acute paralysis attack, where acute CVA, when they come in window period, we thrombolize them. We have a dedicated gastro team. We deal with gastric emergencies like GI bleeds, both upper GI and lower GI bleeds. We have acute abdomen where surgical interventions are required. We have dedicated surgical gastroenterology. All together treat as a team. We approach as a multidisciplinary way. Let me tell you about a recent case of last week which I have seen. This was an interesting case, though we regularly see it. It was a left dense pneumonia where he presented. His presentation was initially just with cough and cold, followed by a fever for one day. Then later on he neglected and took treatment at home. He approached to us with after 1 week with worsening of symptoms. His major complaint was shortness of breath. On evaluation, on presentation, he was having severe dyspnea. He was on oxygenation. CT scan showed left dense consolidation. We were suspecting some tuberculosis because of his background working. But eventually he required invasive ventilation because of worsening hypoxia, and he underwent bronchoscopy, where we have sent bronchial wash for examination. That eventually grew bacterial growth. So let me tell you briefly about pneumonias. Pneumonia is, in simple words, if you say, is a infection of lung parenchyma. There are different kinds of pneumonia. Usually we see community-acquired pneumonia or hospital-acquired, or sometimes MDR related. Community-acquired pneumonias, usually we see the source of infection can be from a bacteria or a fungus or protozoa or viruses. Recently we have encountered a pandemic in 2020 and 21 where we had severe coronavirus infection, which we all know as COVID pneumonia. So these pneumonias are very common. So what we should understand and should know about pneumonias as a general population. One, how it starts or what are the symptoms. If you see every pneumonia simply starts with a cough or either having small kind of expectoration, which we call as phlegm or sputum. They can have sometimes myalgias, they can have nausea, sometimes vomiting, sometimes chest pain when the pleura is involved. If it is worsening, they can have bloody sputum or cough where they are exploration blood in their phlegm. Or if it spreads to other organs, it can cause multi-organ failure. Sometimes they come in confusion state also. These are the common symptoms what we have to be aware. Who are more prone to these kinds of infections or severity of the pneumonias? We have to be very cautious in persons who are very young or elderly, or who are having uncontrolled sugars, recently underwent any major surgeries, or who are immunocompromised or on chemotherapy, or expecting mothers, people who are traveling to large gatherings or to places like forts. So on such sites, they are places who are traveling specially to monuments or historical sites where they are never exposed to such environment. They are more prone to infection, and especially who are asthmatics on inhalers, they are still more prone. So when to approach? If you see, when we have initially cough or fever for a day or two, we try to treat ourselves at home initially, and then it is worsening, then we try to show to a family physician, and then it comes to severity, then they present to us in an emergency room with shortness of breath, with having severe respiratory failure or oxygenation going down to less than 80. So whenever we are having cough with fever, which is preceding more than 24 hours, or the worsening of symptoms, or high grade fever, or these susceptible individuals, we should approach to the hospital or a dedicated pulmonologist at the earliest, so that we try to prevent these complications prior hand. Thank you.